My name is Jayna Patel, and I'm a kidney transplant coordinator. Welcome to the Abdominal Transplant Center. We are located at Recipient Medical Center at the University of Texas, Austin. In this video, we'll go over some educational information on what to expect prior to your evaluation. Informed consent. Informed consent is how we, your care team, will communicate and educate you on the transplant evaluation process. First, we will go over your options. Right to refuse. You have the right to refuse evaluation for a transplant. If you choose not to undergo an evaluation, you will not be considered a transplant candidate and should continue to follow up with your referring provider. If you complete your transplant evaluation and are selected for transplant, then decide that you do not wish to undergo the transplant surgery, you have the right to do so. If you are on the national wait list and decide not to undergo transplantation, your name will be removed from the waiting list. However, if you later change your mind and wish to be considered again for transplant, you have the right to request a referral for another evaluation. Once you are on the national waiting list and are offered an organ, you have the right to refuse the offer. When you accept a place on the transplant list, we generally expect that you will accept an organ when offered. We understand that there are rare and special circumstances to refuse an organ offer. This will be reviewed by the team to determine the best course of action for your health status. Alternative treatments. Alternative treatments such as hemodialysis or peritoneal dialysis may be available for your medical condition. You have the right to refuse alternative treatments. However, if you choose to do so, please discuss your options with your referring provider. Pre-transplant evaluation. Your transplant evaluation involves 3 distinct phases: pre-transplant, transplant, and post-transplant. The purpose of this evaluation is to determine if transplant is the best treatment option for you. You will likely undergo several tests, procedures, and visits to the Abdominal Transplant Center. You will have the opportunity to meet and interact with your care team, and the purpose of the evaluation is to identify potential resources and additional support that may be needed for the transplant. The transplant team members you will meet are your transplant coordinator. Your transplant coordinator provides education and guidance around the transplant process. Your coordinator will be your main point of contact and available to you during your transplant journey to provide support, answer your questions, and keep you informed throughout the process. Advanced practice provider. Your care team includes nurse practitioners and physician's assistants with extensive training in caring for transplant patients. You will meet and work with these providers throughout your pre-transplant evaluation, your hospital admission, and your post-transplant care. Transplant surgeon. Your surgeon will meet with you and discuss the procedure, risks, and potential complications of your surgery. Transplant nephrologist. Your nephrologist will assess the current function of your kidneys and perform a medical evaluation to assess your candidacy for transplant. Social worker. Your social worker will perform a psychosocial evaluation assessing your candidacy for transplant, as well as help you identify a support plan for you to be successful after transplant. We highly encourage you to bring your caregiver to your transplant evaluation appointment. Financial coordinator. Your financial coordinator will help you understand your insurance coverage for transplant, medications, and post-transplant care. Your financial coordinator will make recommendations to your team regarding your candidacy surrounding your current financial plan. Dietitian. Your registered dietitian will review dietary recommendations, educate you on healthy food choices pre- and post-transplant, and assess your transplant candidacy based on your nutritional status and weight requirements. Pharmacist. Your pharmacist will assess your current medication regimen and provide you with education on what your medication needs will be after transplant. Your pharmacist will also assess medication interactions, side effects, and your adherence to taking medications. Research coordinator. Del Seton Medical Center, in collaboration with UT Del Medical School, are involved in research activities related to transplantation. You may interact with a research coordinator during your transplant journey to offer you the opportunity to participate in transplant research projects. Additional specialists. During your evaluation, the doctors may determine you need to see other specialists. You may be referred to specialists in heart, diabetes, etc. Testing. A variety of tests will be performed to determine your candidacy for receiving a transplant. Please refer to your transplant itinerary for specific instructions. The following tests are commonly ordered and likely to be included in your evaluation process: blood work, chest x-ray, urine testing, EKG, cardiac studies, and abdominal imaging. Additional tests such as ultrasound and/or pulmonary function tests, may be required. You will be informed about specific additional tests if applicable. Some other tests may be required based upon your specific circumstances, age, sex, and other medical guidelines. These include mammogram for women over the age of 40 as recommended by the American Cancer Society guidelines. Gynecologic exam and pap smear. If you are a female candidate for transplant, we will require an updated well woman exam based on the American College of Gynecology guidelines. Colonoscopy. You will be expected to have an updated routine colonoscopy based on established national screening guidelines. Dental clearance. If your teeth are determined to be in poor health at the time of your evaluation, you will be required to visit your dentist and have the necessary treatment or procedures to correct any problems. You will also need to secure a letter of clearance from your dentist that states that you do not have a current infection in your mouth. Organ distribution. There are two types of kidney transplants. First, a deceased donor, which comes from a donor after brain or cardiac death. The second type is from a living donor. The majority of patients seeking a transplant will receive an organ from a deceased donor. All deceased donor organs are allocated according to the policy of the United Network for Organ Sharing, or UNOS. Organ allocation is continuously monitored for fairness, and all candidates receive consideration for each deceased donor kidney. Being placed on the waiting list for a deceased kidney does not guarantee that you will receive a transplant. A living donor kidney is the fastest and most successful way to receive a kidney transplant. There are several methods of obtaining a living donor kidney transplant, and we will review these options with you at the evaluation. Risk criteria for donor organs. Certain conditions in the donor may affect the success of your transplant, such as the donor's history and the condition of the organ when it is received in the operating room for your surgery. The U.S. Public Health Service considers some donors to meet risk criteria due to some behaviors that puts them at risk for harboring a bloodborne infection, such as HIV, hepatitis B, or hepatitis C. In general, our physicians believe that the potential benefit of accepting a risk criteria donor organ is greater than the risk of contracting an infection. You will be considered for all standard organs. However, there are some special considerations to expand your donor pool. These options will be explained in the next few videos. Your willingness to consider these donor types does not exclude you from a standard donor offer. Scientific Registry of Transplant Recipients, or SRTR. Each transplant facility is required to submit data pertaining to their program related to patient and graft or donated organ survival for the transplant recipients and living donors they treat. This data is available at www.srtr.org. You are welcome to visit this site at any time to review 1- and 3-year data related to the Abdominal Transplant Center, as well as all other transplant centers across the United States. The Abdominal Transplant Center's most current data is included in your evaluation packet. Transplant treatment options. Kidney transplantation is a treatment option for end-stage renal disease. The potential benefits of a transplant do not result from the surgery alone, but are also dependent upon you following your treatment plan post-transplant. We cannot predict exactly how your body will respond to the transplant. The operation is complex and there are risks. Transplant operation. When a donor organ becomes available, you will be called and asked to come to the hospital as soon as possible to prepare for your transplant surgery. During the transplant surgery, you will be placed under general anesthesia, and you will also be placed on a machine to help you breathe. The transplant surgeon will make an incision in your lower abdomen and transplant the kidney. You will be in the operating room for about 2 to 4 hours for a kidney transplant. Post-surgical care and recovery. The length of stay in the hospital is typically about 3 to 5 days, but will depend on your rate of recovery. Some people heal faster or more slowly than others. You will learn more about your post-transplant care and medications during your hospital stay. After you leave the hospital, you will still be recovering. For the first few weeks, you will have restrictions related to your activities and will not be able to drive. If you experience any post-operative complications, your recovery time may be longer. During the recovery period, your care team will follow your progress. You will return for scheduled follow-up appointments and have blood work drawn frequently. If you live a long distance from the transplant center, you may need to make arrangements to stay in the Austin area until your condition stabilizes, and your care team feels you are able to spend several hours in your car traveling back and forth to the Abdominal Transplant Center. You will be monitored long-term after your transplant and will need to make yourself available for exams, biopsy of your transplanted kidney, laboratory testing, and scans. Potential medical risks. The potential benefits of a transplant do not result from the surgery alone and are dependent upon you following your treatment pathway post-transplant. You must be aware of the potential risks and complications that can result in serious injury and death. Other complications include infection, rejection, blood clots, blood transfusion reactions, delayed graft function, kidney blood vessel clots, bleeding, urinary complications, nerve damage and/or paralysis, fluid collection around the kidney, scarring, pressure sores, burns, pneumonia, heart attack, and/or risk of developing cancer. Medications and pregnancy after transplantation. Some medications that may be prescribed after your transplant surgery should not be taken during pregnancy. Mycophenolate, or Cellcept or Myfortic, has been identified by the FDA as one of the medications that may put a developing fetus at higher risk for miscarriage in the first 3 months of gestation and at increased risk for birth defects. If you are able to become pregnant, please speak with your doctor about the risks involved in taking mycophenolate and other transplant-related medications during pregnancy. Consult with your transplant team first if you are considering a pregnancy. Your care team may order pregnancy tests before and/or after your transplant if indicated. Potential psychosocial risks. When you recover from transplant surgery and move past the initial post-surgical period, you will no longer be considered disabled because of your end-stage kidney disease. This may impact your disability benefits. Consult with your transplant social worker and financial coordinator for further information. Potential psychological risks associated with the transplant may include depression, post-traumatic stress disorder, generalized anxiety, anxiety regarding dependence on others, and feelings of guilt. If you have additional questions, please discuss them with your transplant social worker. Waiting time transfer and multiple listings. Once listed for a transplant, you have the option of being listed for a transplant at multiple transplant centers and the ability to transfer your time without losing accrued waiting time. Please refer to the UNOS booklet, Questions and Answers for Transplant Candidates, about multiple listing and waiting time transfer in your education materials folder. Transplant evaluation expectations. It is important to arrive on time the day of your appointment. You will see many providers and have multiple tests on a strict schedule. Coordinating your evaluation day is lengthy and difficult to reschedule. Failure to keep appointments will delay your process and may result in your referral being closed. If this occurs, you may be eligible to be re-referred at a later date. You must cancel and reschedule appointments at least 24 hours in advance if you anticipate missing your appointment. Thank you for choosing Del Seton Medical Center at the University of Texas at Austin. We look forward to being a part of your transplant journey.